Appreciate that. We know concussions can cause short-term problems like headaches and loss of balance, but now this potentially alarming study from the Mayo Clinic warns that concussions could cause Alzheimer's and many decades after the initial injury takes place. And we're joined by Dr. Ernest Patti with more on that. St. Barnabas Hospital, Senior Attending Physician of Emergency Medicine. Thank you, Doctor, for coming in.
Thanks, Connell, for having me.
Okay, so what does this study mean to you? What's the significance of it?
Well, the significance of the study is it showed that any type of traumatic brain injury, which could have been many, many years earlier in your life, because the study focused on folks in their 70s and 80s, can lead to an accumulation of a protein in the brain called beta amyloid. And this protein has been linked to development of Alzheimer's disease. So they're linking the trauma early on in life with the progression of this protein buildup down the line.
At a time years ago, and I know you brought your bottle with you, maybe to give us a demonstration of what happens in these injuries.
Well, you know, I always like to bring models with me because a picture does speak 1,000 words. And, you know, the brain is a wonderful organ. It's soft, it's pliable, it's sort of resilient, but at the same time, it's delicately balanced inside the skull. And many times, it's injured. And, you know, the brain can get concussions and bruises, a bruise injury to the surface of it, just like a bruise in your muscle. The problem with the brain is it controls our thinking and our thought processes.
These injuries that happen that you alluded to, where people are now in their 70s and 80s, would most likely have been very serious injuries, wouldn't they have, years ago, if people even knew that they happened?
Yeah, that's the one thing that most of us didn't think of, is these folks are much older than most of us, and if they were injured 50, 60 years ago, we didn't have CAT scans back then or the technology to actually evaluate their injuries.
Yeah, so they could have had, they thought just got a bump in the head, and it could have been much, much worse.
It could have been much worse than that, exactly, because most folks back then only went to the doctor when they were seriously injured.
Let me ask you the question that pops into my head anytime we see a study like this, and that's basically, what do we do with this information? I mean, now that we know this, I mean, what do we do with it?
Well, basically what we have to do is be more vigilant in our evaluation of especially children and adolescents and younger folks with brain injuries. You know, you don't want them going back and playing sports or getting involved in activities too soon. You know, you want to give the brain time to rest and to recover from that injury, because we don't know if it's one or more injuries that can cause this accumulation.
We're showing football video, as often we do when we talk about concussions. It's been a serious problem for the NFL to deal with, and that's been well documented, I think, by this point. But
football,
you brought up
boxing.
Absolutely. You brought up sports, and I was going to say, in general, it's not just football. I mean, there have been big concussion problems in soccer and other sports.
Lacrosse, hockey.
Of course, yeah. And even in these sports where they wear helmets, there's still concussion problems. So for people who have children who play these sports, and as you say, you want to avoid that second concussion, what are the keys? When do you know that, hey, you know, it's not just a bump in the head. I better take my daughter or son to the hospital and get it checked out? Normally,
I mean, I treat these injuries every day in the emergency department, and what you want to look for is changes in their memory. You know, is their thinking a little altered or distorted? Did they actually black out and have loss of consciousness? Are they complaining of nausea or persistent headache? Are they sort of listless and just not as energetic as they normally are? Any of these subtle signs are things that are going to make you be more concerned that they could have an injury that's bigger than you initially thought.
A lot of this is we can't do a lot about, as you've said, and unfortunately it's just the way it is. But do you think that knowing more that we know now makes it less likely that a study like this will appear years from now, that we're doing better than we used to?
Well, I think one of the good things is the technology for safety equipment is grown tremendously.
That's true.
Football helmets, hockey helmets, equipment, protective equipment, seat belts, things like this can cut down on the injuries, the number of injuries. Our ability to diagnose it sooner is also much improved with our MRIs and our CAT scans.
So that'll help.
That'll definitely help. But common sense really needs to dictate. You know, if your child's involved in these sports, you want to make sure they're conditioned properly, that the coaching is good, and that the rest periods in between the practices and the activity level is appropriate. Proper nutrition, mind and body exercise at the same time. You also want to do those mind exercises, you know, and read and converse and have interactions with folks. That also keeps the brain strong.
Keeps you sharp. Dr. Ernest Patti, thank you very much, sir, for coming in today.